Hi everyone, and welcome to our September meeting for Diabetes Support Group. Before we go in for tonight's presentation, we'd like to recap from our August meeting. So if you remember from our meeting last time, it was regarding mental health and sick days regarding diabetes. Mental health can actually impact many aspects of our life. Thoughts, feelings, beliefs, and attitudes can actually affect how healthy we are. So untreated mental health issues can actually make our diabetes worse, which is why we should learn how to manage our mental health. It is important to manage our stress because it can actually affect our blood sugars, causing them to rise or to fall. And also long duration of stress can also worsen our health. We should manage this by avoiding triggers such as things that make us more stressful, any particular people or environment that we should limit. Also, as well, we should all limit caffeine and alcohol intake, eating a balanced diet, and also getting moving as well, such as yoga, meditation, and exercise can help with our mental health. And overall, we should always continue to regularly see our doctor regarding our mental health and if we have any further questions about it. For dealing with sick days, prevention is key and can prevent getting sick, such as washing our hands, avoid contact with sick people, and also following COVID-19 recommendations, such as wearing a mask and following social distancing as well. However, despite the preventive measures we may take, we still may get sick. So when we do get sick, we should plan ahead, making sure we have enough food, water, and also medications during the time that we are sick. And even though that when we are sick, we don't feel well, we should always continue to regularly take our medication and insulin to manage our diabetes. And when we are sick, it can actually cause our blood sugars to change as well, which is important why we should continually to test our blood sugars frequently. So we know that flu season is coming up and it's important that we get our annual flu shot. You're able to get your annual flu shot from your local pharmacy where they can do that for you as well. For tonight's guest speaker, it's Dr. Bunch. He is a PGY2 family medicine resident. He graduated from the University of Kansas School of Medicine in 2019. And some fun facts about Dr. Bunch is he enjoys running, biking, watching movies, and other activities.
All right, hello, and thank you so much for inviting me here to speak tonight. It's definitely an honor, and I'm excited to talk about tonight's topic. So the topic that I was invited to talk about tonight has to do with what my recommendations and kind of what the general recommendations are for you to have a productive diabetes appointment with your doctor or medical provider. So, the first thing that happens is, you find out that you've been scheduled for a diabetes appointment, whether this is your first diabetes appointment and you're establishing with a new provider, or you are having a diabetes follow-up appointment. This information really kind of applies to all of those scenarios. So some possible questions that you may be asking yourself as you're preparing for your diabetes appointment is, how do I prepare for my appointment? What should I bring? What should I wear? And what are the things that I need to know? So just to kind of help you mentally prepare for the visit, it's really important to keep in mind that most visits with your medical provider or your diabetes follow-up appointments are going to be typically between 15 to 20 minutes. And so that time can go by really fast. And so adequate preparation on your end will really help you get the most out of your appointment with your provider. And that way you can really get the most out of your time. So I think one of the most common questions that gets asked is whether or not you should eat before your appointment, or whether or not you should eat before your diabetes appointment. And honestly, most of the time the answer is yes. I think typically there's very few scenarios where you need to be fasting, or which means that you usually don't have anything, haven't eaten or drank anything other than water for at least 8 hours or so. But usually I like to see my patients where their blood sugars are normally going to be. So I'd rather you eat the things that you normally eat and come in just how you normally would. And now there are a couple of exceptions to that, which really I would just ask your doctor if they particularly want you to be fasting, but usually not. Usually you're okay not to. So the first thing we'll talk about is what you should bring to your appointment with you. So I think one of the most helpful things is for you to have an up-to-date list of your medications. I feel like a lot of people carry around some form of paper or list that has their medications on it. The only thing that is the most helpful is if you update this, because oftentimes we are making frequent changes to our medications or your medications, and so even little things like dosing and how often you're taking them can be really helpful to your provider, because it really can affect what medications we prescribe and what our recommendations might be. So I really do encourage you, even at your just general follow-ups that aren't related to diabetes, that you try to keep your med list up to date, and even your provider can print one off for you too, which I like to do for my patients sometimes. So I would say one of the most important things to bring with you to your diabetes appointment is your blood sugar logs. This is super helpful, and now it is worth pointing out that not everyone needs to take, not all people with diabetes need to take their blood sugars the same as other people with diabetes. Your doctor may want you to just check your sugar once in the morning before you have breakfast, and sometimes they may even want you to check it less than that. Now, generally, if you're on insulin or some form of an injectable diabetes medication, typically we like you to take your sugars more often. Classically, it's in the morning, before each meal and at bedtime. I think a table like the one I have here in these slides is one of the best ways to do it. One where you have the date on there, and you can line up the sugars from breakfast, lunch, supper, bedtime, and that really helps us compare what your sugars are doing at those times of the day, and even having a small note section like this one has, so you can put a note, I did this today, or my sugar was this today because this may have happened, or you could even write, hey, today was my son's a birthday party, and I had a piece of cake, and so that way, might explain a higher sugar or something like that, or just anything that might be helpful for you to remember. But, your medical provider often makes decisions on what adjustments need to be made to your medications based off of your sugar logs. And it's really important that if you do write the numbers down, be honest with them. I'd much rather see what they really are, so that way I can help you the most, and kind of go from there. So this is one that people may not think to bring, but an up-to-date list of your vaccinations is really helpful. Now, if you've been seeing the same provider for a while and you don't get medications from any other provider, they typically should have this on file, but this is mostly for if you're establishing with a new provider, or if you get vaccines at the grocery store or at Walgreens, it's even like a flu shot or something like that. It's really nice to bring that documentation with you to your appointment, so your provider can be aware of kind of how up to date you are on your vaccinations. And there are some vaccinations that are recommended for people with diabetes. Pardon me, I'm sorry, that may not otherwise be recommended, so it is really important to bring that with you. Now, this is one that I feel like most people may not think to bring, but that is some form of journal, or even if it's just a piece of paper that you've kind of written down what activities you've done throughout the week. This is just really nice because diet and exercise really are important and key components into managing your diabetes. And sometimes we can notice trends if we write things down, like even if it's just simple, like, this is what I ate these days, and these are the exercises I performed, even if it's just walking or working outside. I think those things are good to write down, so we can work together to find areas that we can improve on, and also areas that we're doing well on. So this, again, is something you may not think to bring, but it would be very helpful to your provider to bring. This is just kind of another thing. This is, again, more important if you're establishing with a new provider, or you're seeing a new doctor coming from another doctor. But things you may not think are, or we may ask you to sign like records release forms, so we can obtain your records from your previous doctor. We like to see what your previous lab values were, hemoglobin A1C values, and things like that. It's super helpful for us to see trends in your labs and your diabetes, and it kind of helps us make decisions. Another thing, if you get your eyes checked by an optometrist in town, it's really nice to have those records, just to, even at your primary care physician's office. It's really nice to have those just to make sure that your eyes are doing well, and we can kind of help make sure that that's going well as well. So the next topic I'll discuss is what should you wear to your diabetes follow-up appointment. So the big thing is just, one of the big things to wear is shoes and socks that are easy to remove. Now, you don't necessarily have to wear slippers, but it's just that oftentimes your physician's probably going to want to do some form of a foot exam, and if you're not sure why, that's mostly because some people with diabetes can develop nerve conditions and things that where your feet can become damaged, or you can get infections that you may not be aware of. And so I think part of a good thorough diabetes follow-up and exam is for your provider to examine your feet, which is strange at first, but it really is part of keeping you healthy. But that is something really nice to bring, is shoes and socks that come off easily for that purpose. And that kind of brings me to, what should you expect during the exam with your doctor at your diabetes appointment. So again, a foot exam is something that is sort of unique to the diabetes follow-up. And again, we're just making sure that your feet are looking healthy, you're not having any skin changes, no signs of infection. Typically your doctor is going to recommend that you perform daily foot exams on your own. But again, I think that a foot exam is a good part of a thorough exam. An eye exam. Now this is a pretty limited eye exam. We use something called an ophthalmoscope, but they may turn the lights off and use this really bright light to look in the back of your eyes. And that just kind of sometimes can show us whether or not you're having vision changes or changes in the structures of your eye that sometimes diabetes can cause, that we want to be aware of early. And another thing is your weight. I know sometimes we all like to get self-conscious about our weights and things like that, but it really is important that we get an up-to-date weight with each visit, because that can help us see trends and see if there's a correlation between changes in your weight and maybe what your blood sugars are doing. So it's not always just for you to know, but it's really for your doctor to know too, what your weight, where your weight's at, and it really is confidential between you and your physician. So I know some people will oftentimes refuse to have their weight checked because they're embarrassed, but really if you come in, it's really helpful to have your weight for the exam. And the most important thing for you to bring is your questions. I think the biggest piece of advice I have is just to write down your questions. It's so easy to get wrapped up and forget what things you want to ask. And so I think really writing down your questions will help you not only remember them, but make sure that you're able to get to them and answer them during your appointment. And I really can't stress enough, there's really no silly questions. The diabetes can be really complicated. And to be honest, before medical school, I hardly knew anything about diabetes. And so there really are no silly questions. And it's even okay to ask things like, what should I ask, or what should I know, or what things would you like me to know? And that's okay to ask your provider that, because sometimes it's hard to know the right questions to ask. But again, there's no silly questions, and even the basic stuff of just, what is diabetes? That's okay to ask those questions to your provider. You may see that with some of the time constraints of the visit, that your doctor may want to print off some information for you to read at home, and sometimes that's just to help you kind of learn on your own or help remember some of the things that we talk about. I find that the printouts are pretty helpful sometimes. So I think some common questions, just very basic questions that are definitely okay to ask your provider, and I think honestly every diabetic should probably ask their provider is, how often should I check my sugars? I kind of mentioned earlier that it really does depend on the severity of your diabetes and what medications you're taking. And so I think that's really something to clarify with your provider. And this might be something that changes as some of your medications are changed. When should I take my medications? There's several different types of diabetes medications. Some are pills, some are injectables, such as insulin that you take once a day or even with meals, or sometimes there's even medications you just take once a week. And what medications you are going to be on is largely going to be up to your provider and things like that. But knowing when you should take your medications is going to be crucial for you to be successful. And then again, how do I take my medications? Again, kind of touching on what I said, there's pills, there's injectables, and multiple different types of medication. So I think asking how and when and those types of questions are definitely things you want to know. And again, bring your concerns. I think these are sometimes what can be most easily overlooked by providers, including myself, is let your doctor know what obstacles do you have that I may not be aware of, or they may not be aware of. These could be things such as I really have a hard time taking this medication at this time because of this, or because of work I find it really difficult to do this, or the list really goes on and on. If there's anything in your life that you feel like makes something about your diabetes plan difficult for you, please let your doctor know. That's something that we can work with and potentially help you overcome as well. So this is a topic that I think, given the certain situation now with the coronavirus pandemic, it makes it a little bit more complicated. But before coronavirus, this would definitely be a yes. And so ultimately, the answer to this is whether or not you should bring a guest is going to depend on what your clinic is recommending and whether or not they're okay with that. But if they really are okay and you can bring a guest, I would definitely recommend it, especially for your first diabetes appointment. And if you're new to being diagnosed with diabetes and you have questions about your medications and everything else, I think it's great to bring a guest or a loved one especially someone who's going to be living with you, that can learn more about diabetes, and so that way they can help you be successful. I think that's definitely a nice thing to be able to do. One of my biggest pieces of advice again, and this just goes in general and not just for diabetes, but be honest with your doctor and with yourself. I know everyone forgets to take their medication sometimes. I take a medication for my allergies, and I can tell you I forget to take it all the time. And I will tell you I am certainly no saint when it comes to taking my medications. And letting your doctor know that you forget them and how often is really helpful to know as a provider, because then we can help decide whether or not we really need to change your medications, or if we just need to change how we're taking them, or if we can make a plan to make you more successful to take your medications, and help you not forget to take them in certain scenarios and things like that. Because ultimately, we don't want to make changes to your medications if maybe you're just not taking them as often, or you're forgetting, because sometimes that could have poor outcomes. many diabetes medications are really expensive, and that's something that we see all the time. And some of these medications are really expensive, and so oftentimes you may get prescribed a medication and you realize, oh wow, this is more expensive than I thought. I'm not sure if I can afford this. And some people don't take their medications because they can't afford them, or maybe their insurance changes and their insurance no longer wants to cover that medication. Please, I really encourage you to be open about this with your doctor, because the nice thing is there's a lot of options, and sometimes we can work around this. That's definitely something to let your doctor's office know, so that they can help you get the medications you need. And I'd say the big thing with diabetes is everyone's, it's needles are scary. I mean, it's not fun to have to prick your fingers and taking insulin with injections. It's not fun. And I'll tell you, I don't like needles more than anyone else either. I know when it's my turn to get my flu shot, I'm certainly not excited and not giddy with the excitement. But again, and this is just encouraging you to be honest with your doctor and express your fears and your concerns. And your doctor's here to help you. I mean, really, we're all here to help you to be successful. I'm certainly not going to judge you, and neither is your provider going to judge you on, or at least they shouldn't. If they do, you should change providers, because we're really here to help you be successful and be healthy. And again, diabetes can be confusing and overwhelming. There's a reason why your medical team trains for so long, is because this stuff is complicated, and I certainly don't expect you to completely understand everything, all the ins and outs of diabetes, especially during your first visit. And you may see that your provider may recommend you see someone like a diabetes educator or a dietitian, and these are specially trained people who we're going to sit down with you, and we'll kind of they can go over several things, whether it's just learning more about diabetes, or how to take your medications, or how to check your blood sugars. These are all great people to have on your side and on your team to do well. And if your doctor refers you to a dietitian, you may think, oh, it's not that I need to lose weight, and that's not necessarily what your doctor's saying. Often diabetics need to make some subtle changes to their diet, and learning what foods can best optimize your diabetes control, I think, is really crucial to being successful. So again, kind of to summarize, the best way to get the most out of your visit is really plan ahead. Again, the visit can be short, unfortunately, but being prepared and bringing your materials with you. Again, bring your questions, write them down. Bring your blood sugar logs, bring your diet and your exercise logs if you have them. These are all super helpful things for your doctor to know. Set out the clothes you might want to wear. Again, emphasizing clothing that is and shoes that are easy to take on and off for your exam is super helpful. And you may be asking, when should I come back? How often do I need to see my doctor? This is really going to vary for each person, but typically diabetes follow-ups are every 3 to 6 months, kind of depending on how severe your diabetes is, and there's several factors incorporated into that. But I definitely recommend that with diabetes you should at least see your provider at least every 6 months. But they may want you to see you sooner than that, and they may want to make some changes and things like that. So you might see a change in that interval. Well, thank you all again so much for inviting me, and I hope this was helpful to you. I really wish the best for all of you, and I know that if you kind of follow some of these basic tips, I really think you're going to get the most out of your appointment. And good luck to you with everything. And thanks again.
So before we end our meeting for tonight, we'll just like to have some closing remarks. So for our wrap up, please email us with any topics that you guys would like for us to discuss for our next meeting in Diabetes Support Group. And if you have any questions regarding anything that we've talked about today and Dr. Bunch's presentation, you can always email us at diabetessupportgroup@srhc.com. We would like to thank the foundation for supporting us in having diabetes support group, and also for tonight's speaker, Dr. Bunch, on educating us on diabetes. Our next video will be on November 17th, and you can look for advertisements on Facebook and also the SRHC website. And always, if you have anything that you want to mention to us, you can always email us again at diabetessupportgroup@srhc.com. Thank you.